Miss Matilda is undergoing a general anaesthetic today to be desexed. She is the sweetest little girl and very photogenic, so come along for the ride and see exactly what happens today for her surgical procedure. After arriving to the clinic, Matilda undergoes a thorough physical exam with the surgery vet and nurse. This is a great opportunity for any concerns that her owner has to be discussed with our surgical team, including any health issues she may have or any further questions. As you can see, she loved this and purred during the whole experience. Matilda is then admitted to our hospital for the day. Here is Matilda getting lots of love and cuddles from one of our beautiful vet nurses. Soon after arriving, a catheter is placed in her cephalic vein, giving us intravenous access for her sedation to be administered. This also allows us to put her on fluids during her surgical procedure. Putting surgery patients on fluids helps support their organs while under general anaesthesia and contributes to a smoother wake-up. We try to make this as stress-free as possible so that our patients can enjoy the experience. Matilda is then sedated and clipped on the prep table before moving into the sterile surgery room. She is getting spayed today. As you can see, she is completely stress-free and is still loving the head scratches. We then introduce the induction jug that we are slowly giving as she starts to drift off to sleep. We then place an endotracheal tube that helps open up her airways, and through this tube passes oxygen and our anaesthesia drug to help keep her asleep. Here is the surgery nurse checking her vitals and monitoring how she is handling the anaesthetic. This is completed every 5 minutes. Matilda undergoes a series of surgical preps to ensure that her belly is squeaky clean and sterile. The attending veterinarian also goes through a series of cleans themselves to make sure they are also sterile. They then place a drape over the site so that we can then commence. After her desexing, she gets taken back to her bed where a veterinary nurse sits and monitors her as she's waking up from an anaesthetic. Cats typically wake up from surgery very quickly and bounce back within a few hours. Matilda's owner is then contacted to let them know that she is awake and in recovery. We do like to keep surgery patients for a few hours after, just to make sure there's going to be no adverse reactions. She is then discharged in the afternoon by the attending veterinary nurse to run through some home care instructions. Normally, we do the easy part and the hardest part is left to the owners, trying to keep her rested, but we know you can do it. Good luck with your recovery, Matilda. Thank you for being the best patient today.